Hi, I'm Lynn Kettell-Slifer, family nurse practitioner. Welcome to Health Partners LLC.
What kind of practice is Health Partners LLC?
Our practice is a functional medicine based family practice.
What is functional medicine?
Functional medicine is best explained through this diagram that we have here from the Institute for Functional Medicine. I am trained as a family nurse practitioner. I have my advanced practice training through the Institute for Functional Medicine, and it really looks at all of the aspects of health in a specific assessment and diagnostic way: mind, body, and spirit. And physiologically, all of these can impact each other. There's volumes of research around this. There's significant evidence around this form of practice. How does it differ than standard practice? Most people come into the healthcare system where the branches come off the trunk of the tree, if you will. They have symptoms. We may run a few diagnostics. We may send you to some specialists, and then we call it something. You have diabetes. You have autoimmune disease. Primarily at that point, we treat with pharmaceuticals, and we're generally staying in the branches of the tree treating symptoms. What functional medicine says is, let's go down into the trunk and the roots of the tree and determine what are the causes of those symptoms. What are those determinants of health that we can influence by making changes through diet, through lifestyle, through supplements, through medications, etc. And then let's work to reduce or eliminate the symptoms or heal the individual through all of those methodologies.
What kinds of conditions do you treat?
So the kind of conditions we treat were quite different than most primary care or insurance-based practices, in that we generally spend a lot more time with our patients understanding complete health history, starting from childhood and birth and going on through, because in most individuals, all of that is relevant to your overall health. In standard insurance-based practice, we have a limited amount of time to spend with a patient. I know this, I've been in insurance-based primary care, and therefore we are mostly focused on treating the existing symptoms or the most current problem. So functional medicine allows us to dig a lot deeper. It allows us to evaluate all of those components of health that may be contributing to symptoms and then begin to address them. The types of conditions that we see in our practice, well, we like to see patients that are healthy and want to maintain good health. And we do see a number of general health conditions, but really, I tend to see a lot of people with GI issues, oftentimes long-standing constipation, diarrhea, bloating, SIBO, all sorts of diagnostics around GI. I also see a lot of autoimmune, whether that be Lyme disease, whether that be mold and biotoxin illness and other autoimmune conditions. As part of that, oftentimes we'll see lots of thyroid patients, endocrine, whether that is diabetes, also sex hormone patients, because oftentimes those hormonal imbalances, issues with thyroid, are related to other conditions. And as I like to say with functional medicine and when I see my patients, it's generally not one thing, but a culmination of things over time that have resulted in your symptoms or your disease process. And therefore, most of my patients tend to be quite complex. Our average new patient appointment, for example, is up to an hour and a half long. And during that time, we spend a significant amount of time going through your health history, your particular symptoms, your individual treatment, so that we can better understand you and then work as a partner with you in your health.
Are there other providers in your office?
Yes, we do. We have an acupuncturist that we work with in our office, and She is trained in acupuncture. She's a doctor of acupuncture, and she also is trained and well versed in Chinese herbal medicine, which tends to be quite complementary with functional medicine. And again, a lot of evidence behind acupuncture treatment and also many of the Chinese herbals. In addition, we have an osteopathic physician who comes in and sees patients as indicated or as referred by our practice for medical marijuana approval.
How can people get more information?
So, more information, you can obviously look at the website, dig through the website, contact the office. Stephanie, our office manager, is more than willing to help you with that. Or you can schedule a 30-minute consult to discuss your case in more detail to determine how we would move forward with you, or simply schedule an appointment.